emphasize a lot in terms of building of awareness and communication, in terms of to internal as well as external stakeholders, how and where and when the AI will be used in care delivery, how it will involve people, who are the stakeholders, so that there is an inclusive planning process so that they are involved right from the onset of these AI initiatives, investing in continuous education and training. We want to make sure that AI is deployed and used to augment human capability, not really replacing already shortened workforce problems that every healthcare system is facing. So it requires a lot of clarification how it will reshape roles, how will it augment your human capability in terms of delivering futuristic healthcare, how will it increase operational efficiencies, how will it increase, it will bring more equitable healthcare, improving access, improving affordability. So these are some of the things that we are trying to inculcate and build within our ecosystem as we leverage these AI technologies. AI will not replace any doctor or any provider, but provider with the AI technology capabilities and knowledge will replace a provider which has no AI capabilities in a simple form. So everybody must get educated in terms of how AI is going to be part of their journey, and it's going to be a tool to augment their capabilities, not replace their capabilities. So it is very important that this becomes part of their continuous learning, that they are getting more and more involved in AI technologies. Now, having said that, there will be some roles that will be clearly redefined. There are a lot of work that can be automated very smartly with AI, and those pieces of task in your day-to-day jobs will be replaced by AI. But that doesn't mean that your complete role is going to be replaced by AI. So in healthcare, we are faced with an acute shortage of workforce. There is an increased need for healthcare services as our population moves more into baby boomers. So on one side, there is a huge demand for healthcare services. On the supply side, we have a deficiency in terms of acute workforce shortages. So AI is going to really help in bridging that gap and helping in making future healthcare more affordable, more accessible with the better outcomes. But I don't see AI completely replacing jobs, but they will replace certain tasks that are associated with the roles.